All right. Here we have the outer muscle. It's called the. Let's see, let me do this.
Sorry.
Okay. The outer layer here, we're calling the dartos muscle. Dartos. This is the muscle that gives the scrotum its wrinkled appearance. Inside, we have the cremasteric muscle. The cremasteric muscle is a muscle that lowers the scrotum when it's hot outside, and it contracts. It brings the scrotum closer to the body when it's cold outside. Okay. Now, inside of that, we have the tunica albuginea. I'm sorry, the tunica vaginalis. So the red would be the tunica vaginalis. Okay. And the white line would be the tunica albuginea. Okay, here we have the testes, and above and behind the testes, you'll have the epididymis. So this is the epididymis. Okay. Any questions about the scrotum and the testes? All right, let's look at the penis. This is the prepuce, or foreskin, of the penis here. Okay. The three parts of the penis would be the glans penis, the shaft, and the root. Okay. Shaft is also known as the body. All right. Here is the corpora cavernosa, the gray. Corpora cavernosa is the erectile tissue. All right, here we have the penile urethra, right here. Penile urethra runs along the penis. And this is the expanded area of the penile urethra, which is the navicular fossa. Navicular fossa. The opening of the penile urethra is the external urethral meatus, right here. External urethral meatus. Here. All right, now let's look at this up here. This is the urinary bladder. Leading from the urinary bladder is the urethra that enters the prostate gland. This is the prostate gland. This is the ejaculatory duct that merges with the prostatic urethra, and it leaves the prostate gland and enters the urogenital diaphragm. This is the urogenital diaphragm here. And when it enters the urogenital diaphragm, it becomes the membranous urethra. The membranous urethra. Located in the urogenital diaphragm, you have the bulbourethral glands. Bulbourethral glands are those glands that will secrete 5% of the semen into the membranous urethra. And then, of course, when the urethra leaves the urogenital diaphragm, it enters the penis. It becomes the penile urethra. Okay. Any questions about that? Okay, over here we have the sigmoid colon that leads into the rectum. In the rectum, you have two anal sphincters. This is the internal anal sphincter, which is smooth muscle and uncontrollable, or involuntary rather, involuntary. And here we have the external urethral sphincter, anal sphincter. What am I saying? Urethral. Anal sphincter. And of course, this is skeletal muscle. And that, of course, is voluntary. And this is the anus here. Okay? want to be first?